have a vanilla cappuccino.
Oh, what side would you like?
What's your small cup look like?
The small cup is 12 ounce, right?
That's fine.
Okay.
Yeah, small. And then I think I want to try the blueberry cake donut.
A blueberry cake?
Welcome to my channel. My name is Tamika. Here I make nursing content, family life, and just pretty much anything. I just feel like vlogging, but mainly is targeted towards the nursing community. So today's video is going to be like a day in the life, work from home as a busy OBGYN nurse. Get like a general idea of the things that I encounter at work. So I want to show y'all my shirt. It's so fall-y. It says flannels, pumpkins, hot cocoa, and bonfires. Isn't this cute? We're gonna get started. So it's currently 7:55. I stopped at a coffee shop, got me some vanilla cappuccino and a blueberry donut. Actually, it's a donut shop. And I wanted Starbucks, but I didn't have time to stop and wait in line at Starbucks. So it's a donut shop right near my house where I stopped for the first time. My kids have been there, but this is my first time going. So let me try this cappuccino real quick. Is this gonna stay in here? I don't think that's gonna stay in there. It smells good. Oh, it's so good. This is good, really good. Give me energy and help me stay warm. And then the donut is a blueberry cream cake donut, I believe. Oh, and she put a little donut, what do you call those? Donut balls or donut holes? So cute. That's good. I like that. So I'm gonna go ahead and clock in so I can see which doctors I am assigned to today. Now I work PRN or part-time as needed. I make my own schedule, send them my availability for the month. And what they do is assign me to doctors where the nurse is out of the office. I'll cover that nurse doctors for the day, or whoever is out. They'll just give me 8 doctors, 6 to 8, typically 8 doctors to cover. So we are gonna go ahead and get clocked in so we won't be late. All right, we're clocked in. It's 7:58. The mornings are usually pretty hectic. I hope I don't have food in my braces. I'm sorry if I do. But the mornings are usually pretty hectic, especially the beginning of the week. Just getting through those morning messages may take sometimes 1 to 2 hours. And then after that, it's kind of steady with the messages. So we use Epic as the EMR, electronic medical record. Most healthcare facilities do use Epic. Okay, so I just set my timer. We're gonna work for 50 minutes and then we will take a 10-minute break. And we just do this for 8 cycles until we clock out. So, and excuse my stomach. I had VSG surgery, which I mentioned frequently on my channel, in February, so like 7-8 months ago. So my stomach's making these loud noises, especially since I'm having this sugar early in the morning that I shouldn't be having. All right, so I got the schedule pulled up for today, Tuesday, October 8th. And I'm writing down the doctor's names. Two, 3, 4, 5, 6, 7. Okay, cool. So we only have 7 doctors. I was gonna say providers, but we have 7 doctors for me today. which is not bad. And now we're gonna go to the schedule, the office schedule, and if they're not in the clinic, we're gonna send the messages to the covering provider for advice or recommendations if needed. Okay, so she is out of the office, so her messages are going to this, and then she's in labor and delivery. Take a sip of our cappuccino. It's hot. It was too big of a sip. Oh Lord, all this sugar. Hope it don't make me feel sick. Oh Taylor, I forgot to give you the donut hole. That was so sweet of them. Ten of 10 recommend. Here, open here.
Thank you.
You're welcome. It's blueberry. Only thing about being PRN is like I still have messages in the inbox from last week when I worked on last Wednesday, and today is Tuesday. So hopefully another nurse has addressed these messages. If not, I feel bad for the patient because they have to wait almost a whole week. So let me just go through these messages from last week. Okay, so this one is completed. This one, this patient last week, she has a surgery schedule, and disclaimer, I'm not sharing any patient like identifiers. I'm just giving you an overview. So this patient she has surgery schedule, and she wanted to know if there were other device, and she said she can feel it bulging from her vagina. So she has an office visit tomorrow. So I'm basically gonna tell her if it's not causing her any discomfort, then she can just leave it in place until tomorrow. I sent this patient, she is pregnant and she wanted the RSV vaccine. So I sent the prescription last week. The patient was having bacteria vaginosis symptoms. So I was requesting treatment so we can send in a prescription without the patient having to come in based off of her symptoms. The doctor responded, she wants her to come in for testing, but we can send treatment. So let me, especially if it's a younger patient, so I mean, you just never know. I want to make sure we're treating the proper type of infection. Okay. Oh, let me just make sure this patient scheduled her follow-up appointment. She canceled it. Oh, she came in. Okay, she came in on the 4th. So perfect. That is done. She wanted treatment for BV. So this doctor said it's okay to send the, to send the medication. So every doctor is different. Some doctors will be like, okay, go ahead and send the prescription. Some want you to come in and get tested. So I just let her know, thank you for your patience. The prescription has been sent to your pharmacy. If the symptoms do not improve after treatment, please call the office to schedule an office visit for evaluation. Birth control has been refilled for 6 months. That she needs to call the office to schedule a visit. And now let's actually to work through those, and then I'll come back and update y'all and let y'all know pretty much what the messages were about. Okay, so the first hour or 50 minutes, we were able to cover 7 messages. Okay, so it is 10:14, 10:15. Okay, so I have to call a patient. She has questions, and sometimes if I'm not familiar with what's going on, which it's always good to use resources, so don't feel bad. It don't matter how many years you have of nursing. Always, you know, rely on one of the resources I use. Morning, this is Tamika, one of the nurses calling. Can you verify your last name and your date of birth? Perfect, thank you so much. So I am returning your call in regards to the, okay, when did you notice it? Order, but I feel like you will need a diagnostic mammogram since you're having issues. Call you back and let you know.
Thank you so much.
You're welcome. Okay, bye-bye. I am refreshing the messages and seeing what we have new so far. It's 2 new messages. During my break, I just went downstairs to turn on some deviled eggs. Well, turn on some eggs, some boiled eggs, so I can make deviled eggs to have for a good little protein snack. Let's get through these messages real quick. So far these messages are just the patient responding. Y'all like my little clipboard? So cute, right? I was carrying this to the hospital, but I'm like, I can't even clean it properly with the stickers, so I get so distracted. I need to focus. But sitting here all day, it can be challenging. Increase UTIs. I was trying to make sure this word was 1 word and not 2. Okay, so I sent the message to the doctor. I am currently sending questions for a birth control refill request. So we asked them pretty much the same questions, just to follow up. We asked them when was their last period, any abnormal vaginal bleeding, any headaches or migraines, leg pain, because one of the common side effects of birth control is blood clots. We asked them about any chest pain, high blood pressure readings, do they smoke, because that puts you at risk for blood clots or stroke. And since the last visit, have they started any new medications, any new allergies or new medical diagnosis? And then based off their answers, we can either send a refill, also based off their last visit, the timing of it. If it was within the last year or 2, we can go ahead and send the refills. If not, or if any changes, we send it to the doctor for review and let them determine if they want us to refill it or have the patient come in or switch the birth control or anything like that. So just a little FYI. This patient was just responding saying, thank you for a message I sent her earlier. She just found out she was pregnant and she was asking about traveling. She was asking about traveling advice or recommendations during pregnancy. So this job, it's so, I don't know. So I'm in nurse practitioner school, family nurse practitioner. So initially I had got accepted into Emory, the master's nurse practitioner program, and it's too expensive for my pockets right now. So I decided to attend Chamberlain, where I'm a student now for family nurse practitioner. I really don't want to do primary care. Like I worked in a primary care office or family care practice as a medical assistant, and it is just not something I want to do. I want to specialize, but all the nursing experience I have as a registered nurse is women's health, newborn, and then of course I worked in a jail, so that was only for a few months. But primarily my experience is women's health. But I'm like, do I want to work in women's health? It's really like all I know. It's like, I don't know. But I do know that I'm eventually going to go back for a postgraduate certificate. And I probably will attend Emory at that time. So we shall see. We'll see how it goes. But so she told me her last period date, which is great. No abnormal bleeding, no headaches, no leg pain, no. She's great for refills, except her last appointment was going to her medications. I just wrote a message to the doctor, let him know the patient is requesting a refill. And I put when her last office visit was, that she denied any medical changes, that she knows. And lastly, this one is about FMLA. Sending this to admin and see what she says about this. My throat is so dry. My eggs are finished boiling, so I have definitely been working for 25 minutes because that's how long I set my timer for the eggs. Oh, I almost sent her the birth control refill questions instead of the ones for yeast infection. So we asked them any chance of pregnancy, when did the symptoms start, which she already told me in her initial message, any new partners, any vaginal discharge, itching, burning, swelling, irritation, odor, painful urination, frequency of burning, fever, chills, lower back pain or abdominal pain, and has she tried any over-the-counter medications. And then once I receive her response, I will forward it to the doctor for review and go from there. So let's go get our eggs. Okay, so these are just patients responding. So I'm gonna send these answers about the UTI and the yeast infection to the doctor for treatment recommendations, and then we will be caught up. I'm gonna go downstairs and make the deviled eggs. We have 2 more hours until it's time to get Jackson from school. And that's gonna actually be the end of this video because it's pretty long already. So we'll just do like the morning because it just repeats itself. I check messages, answer messages, nothing exciting. Last night after dinner, I made some Halloween themed cookies. They're hard now. All right, we are done making our beautiful deviled eggs. We're gonna try them, or try one or two. See how it tastes. One more, and then we'll save the rest for the family. Okay, so it's 11:46. We had us a good protein snack and stretched our legs for about 15 minutes. Now let's get back into these messages because before we know it, it'll be time to go get my poo from school. All right. Okay. Oh, excuse me. This doctor corrected my spelling. The question I had about the, is it one word or two? First I had it two. Then I Googled it. It said it was one. She's gonna prescribe the patient Keflex, which is an antibiotic. And I'm just gonna send this to the pharmacy. She didn't say how often. How many? And say thank you. How many tablets? Y'all, I think I just sent I think I just sent the message to the patient instead of the doctor. Oh, I hope y'all don't hear my stomach. Yes, I sent it to the doctor. Oops. I mean, I sent it to the patient. So I need to brush my teeth because I have eggs stuck in my teeth. My body is making all kinds of noises. Okay, this one is different. This patient is writing, oh gosh, it's in Spanish, but the message is pertaining to her glucose gestational diabetes test. Let me translate this to English. I just use Google Translate and copy and paste. With the 1 hour glucose test, the patient does not need to fast, but for the 3 hour follow-up glucose test, if the 1 hour was abnormal, the patient does need to fast. So let's look at her results. Let's see. Her result was, 168. So it should be below 135. So, oh, the provider already, so she was just responding to the doctor's message. Let me see something. Let me see. It's in Spanish, so I have to translate it again to see exactly what he said. It says, oh, yeah, 135. And that was her 1 hour. 135. Let me just send him a message. And I say she was 25 weeks pregnant. One hour glucose 168. Her EGA is, what's her EGA? It's 25 and 1. Does she need orders for a 3 hour GTT? Thank you. Okay, next. This patient is writing about test results. She's pregnant. Oh, she's 5 weeks pregnant. Oh my gosh. So I don't know what test results she's referring to because everything looks normal. She had a CBC, complete blood count, CMP, FSH, follicle stimulating hormone level, thyroid, TSH, testosterone is still pending, prolactin, and hemoglobin A1C, but everything looks within normal range. Let's see, HCG test, because her urine pregnancy test was negative. So let me just send this to the doctor and I'm just gonna put patient requesting lab results positive. Urine UPT, her urine pregnancy test. I'm getting sleepy. It's 12 o'clock, so I'm gonna end this vlog, and then I'm just gonna work and try to work on my homework because I have a discussion post due tomorrow. And And like I said, it's no need for me to vlog for a whole 9 hours when I'm basically doing the same thing over and over and over. Swelling, redness. This patient wants to get scheduled for uterine fibroid embolization. Hello?